Hello, I'd like to extend a warm welcome to all of you to this meeting for aged care residents and their families in New South Wales. My name's Kyle Olsen. I work for an organisation called OPAN, which is the Older Persons Advocacy Network, and I'll be facilitating today's meeting. So thank you all for joining us. Before we begin, I would like to acknowledge and pay my respects to the Gadigal people of the Eora Nation. They're the traditional owners of the land on which I'm currently located. We acknowledge that you will be watching from many different lands today, so we pay respect to all elders, past, present, and emerging. Right now, Sydney finds itself in another hard lockdown, and we understand that this is a very trying, it's a very stressful and emotional time for all of you. So the purpose of today's meeting is to provide all aged care residents and their families with a forum where we can provide you with reliable, and that's one of the most important things, and up-to-date information on the situation as it is right now. We wanted to give you the opportunity to be able to ask questions and, most importantly, get answers to those questions about the current COVID outbreak. Now, we received a lot of pre-submitted questions when you registered for today, and thank you so much for that. And those questions will be answered a little later in the meeting. So speaking to you today and answering those very questions, we have Professor Michael Kidd, who's the Acting Chief Medical Officer. We also have Lisa Peterson, who's the Assistant Secretary for the Aged Care Vaccine Task Force. So Lisa is working with the Vaccination Task Force at a Commonwealth level. Also with us, we have Joe Holden, who is the Director of the Aged Care COVID-19 Response from the New South Wales State Health Emergency Operations Centre. We also have Janet Anderson. Janet is the Aged Care and Quality Safety Commissioner. And also joining us is Dr. John Cullen, who is a geriatrician. Also with us as part of our team today, we've got Craig Gear, who is the CEO of OPAN, the Older Persons Advocacy Network, and Marg Carruthers, who's an advocate and regional coordinator at Senior Rights Service. Now, Senior Rights Service is the New South Wales member of OPAN, and it's Senior Rights Service who will be delivering the direct advocacy support to older people and their families right across the state. Now, very quickly, before we get into it, I'd just like to cover some housekeeping. We are videoing today's meeting for those people who were unable to attend, and we'll be posting it to our webpage in the coming days, so it can be watched back at a later date. Now, you will all receive a link to the video in a follow-up email. If you are watching this live and you think of a question that you'd like to ask one of the speakers, simply click on the Q&A button, which is located at the bottom of the screen, and just type your question in there. If you have pre-submitted a question, you don't need to resend it. I already have it, and I'm ready to ask it for you. Due to the large amount of people watching today, all the live Q&A questions will be sent through to me, and then I'll ask them for you. If you are having any technical issues, please use the Q&A button again, and our support people will be able to help you. And they're named Tech Support OPAN. Right, let's get underway. I think it's very important for all of you to know that OPAN and Senior Rights Service, which is our New South Wales state member, are independent bodies. Now, what I mean by that is that they're not affiliated in any way with the government or the Department of Health or the Aged Care Quality and Safety Commission or any aged care facility. What OPAN and Senior Rights Service do is provide free and confidential aged care help, support, and information. So today, as an example, we're facilitating this meeting to give you the opportunity to be heard, to ask your questions and to get answers to your questions. Can I just reinforce, though, that for the purpose of today's meeting, we obviously won't be able to give specific information about individual care homes or individual residents' private situations. However, in saying that, both OPAN and Seniors Rights Service are here to provide you with the help and the support that you are going to need moving forward, or should you need it. We'll also be taking your questions and your comments that you make here today to government. So please know that your voice will be heard. Look, you may want to write down this number, as later you'll be able to speak to one of Senior Rights Service's New South Wales-based advocates on the phone. Now, the number you need is 1-800 700 600. 1-800 700 600. And just as a reminder, if you do think of a question at any time as you're listening to the speakers, please click on the Q&A button at the bottom of your screen and type it in there. But first, I'd like to hand over to Craig Gear, the CEO of OPAN. Craig, can you please start off by explaining how today's meeting came about, and then perhaps if you could talk about the rights that do exist for residents and their families.
Yeah, thanks, Carl, and thanks everyone for coming along to this meeting today. This COVID pandemic has affected older people probably more than most Australians. And as we go into lockdown again, we know that people that are living in residential aged care facilities can be particularly confused about what's going on, might have challenges getting information, or you might be a family member of someone who's in a residential aged care facility. And so we know that there's questions that people will have around what's happening with the vaccinations at the moment. People have already come to us and been ringing us and asking us about visitation. But also people are really worried about that people need to be able to still live well and maintain their function. And we hope that this is a short period of restriction, but just to know that our independent information, education and individual support services are there, and Seniors' Rights Service are here to support you as well. As Carl said before, we want to hear the questions and the things that you need answers to, so that we can get those answers and either have them on our website or reflect those up to government so they can be putting messages out about that. And to let people know that these individual supports are free and they're confidential and available to all older people in residential or in home care as well, because we know that people receiving home care may have questions about continuity of their services as well. We know that COVID particularly hits older people harder as well. And so getting people the right information to make informed decisions about vaccination is one of the other reasons why we wanted to come together today, for those who might be thinking about whether they should have the vaccine now, that a bit of time's passed and they've got a chance to get there. So we'll talk a bit about that today. The Charter of Aged Care Rights applies in the pandemic as well. And it's great having Janet here as the Commissioner, and the quality standards that still need to apply to aged care as well. So where people want information about their rights in aged care, we're here to do that as well. So that's kind of where we wanted to get everyone together today, to provide as much information as possible and let you answer your questions. Thanks, Carl.
Thank you, Craig. Mark, I'm going to throw to you. Can you please explain to everyone the services that Senior Rights Service, as a member of OPAN, can provide that may be of help to the residents and families and carers that are watching today?
Yeah, thanks very much, Carl. And basically, I think Craig and Carl have stolen most of the information that I would have passed on to you, which is that we are a free and independent service. We are the advocacy service in New South Wales and have been for the last 35 years. We are a community legal service, which means that our services do range beyond just the advocacy service, but primarily for today's purpose, our role is advocacy. And our advocate is just someone who you can call. We will listen to your concerns. We will make suggestions as to the options that are available to you. We will help you or assist you to resolve those issues, whether it's just by providing you with information or actually making the phone calls or contacting the aged care providers on your behalf. The other important thing is that our advocates will stay with you. So we'll see you through whatever issue it is that you have brought to us. So you won't be talking to a different person every time you call us. You can ask for the same advocate, or that advocate will continue to communicate with you through that whole process. Another important function that we provide across New South Wales is information sessions for recipients of aged care and their representatives on the rights of older people. Now, rights will come up a number of times today, but it's important that you maintain information about those rights, that you receive information about those rights, and that is our role across New South Wales. So you can call that number and book an education, or go on our website and book an education or information session, and we will be able to assist you with that, because our advocates are also educators and they will be able to provide you with that service. So in summary, our advocates help you to listen to your issues, then help you to work through them and hopefully sort them out for you. And we'll also provide you with clear information about your rights. Thanks, Carl.
Thanks, Marg. Michael, thank you for joining us today. Look, we understand it's a very busy time for you, but we really do appreciate you coming here today to personally answer people's questions and concerns.
Thanks, Carl, and very, very pleased to be taking part today, not only as one of the Deputy Chief Medical Officers with the Australian Government, but also as the son of a mother who is in residential aged care. I know how worrying and concerning it's been for everyone with a loved one in aged care over the past 18 months. I'm very glad that my mum has finally had the 2 doses of her vaccine, so she has that level of protection. But of course, every time an outbreak occurs, we all start to feel anxious again about what may or may not happen. So very glad to be here to answer any questions.
Thanks for sharing that, Michael. I'll now hand over to Janet Anderson, who's the Aged Care Quality and Safety Commissioner. Welcome, Janet. Thank you for joining us.
Hi, Carl, and hello, everyone. It is a great opportunity to spend some part of this afternoon with you. I can echo Michael's comments. We do know that these are anxious times. There is no other way of coming to it. And even with the rising levels of vaccination of residents and of staff in aged care homes, and indeed in home care services, we still become anxious when we hear about community transmission of the virus. The Aged Care Quality and Safety Commission, which I lead, is responsible for holding providers to account for infection prevention and control, for doing everything possible to ensure that the virus doesn't come in, and if it does, to respond quickly and capably to reduce risks to residents and to other staff. Very happy to spend some time with you this afternoon and talk you through a few of the provisions which apply courtesy of the state government's public health order, and I know that Joe Holden will also address that, and the ways in which the commission I lead is working closely with providers to ensure that they're doing everything possible to look after people you probably think highly of or love who are currently in a residential aged care facility in the Greater Sydney area.
Thank you very much, Janet. Now I'd like to introduce Lisa Peterson, who is working with the Vaccination Task Force at the Commonwealth level. Welcome, Lisa.
So much, Carl, and hi everybody. It's lovely to be here this afternoon and to have the opportunity to talk with you. As Carl said, I work for the Commonwealth Department of Health, and I'm leading the arrangements for the rollout of the vaccine to residential aged care. So really delighted to have the opportunity to tell you a little bit about that this afternoon. Thank you.
Thank you very much. Can I throw over now to Joe Holden? Joe, could you introduce yourself and the role that you're playing?
I can, thank you. I'm also very grateful to have been invited to this afternoon. So my role is in the New South Wales State Health Emergency Operations Centre. I'm the director of what's called SHEOC Aged Care. And the group that I head up is really responsible for emergency response planning for COVID outbreaks in residential aged care facilities. So we've done a range of joint planning actually with Lisa Peterson and the Commonwealth just to ensure that we've got sort of a series of robust plans in place if we do have outbreaks in residential aged care facilities.
Thank you very much. And I'd also like to welcome Dr. John Cullen. John, understandably, many people are worried, as we've heard, about not being able to see their friends and family members due to the lockdown restrictions.
Yes, Carl, I just might introduce myself and try and fit myself into the context of this esteemed panel. And thank you for the opportunity to participate. I'm a geriatrician. I'm a practicing clinician. I work in Sydney Local Health District out of Concord Hospital. And I'm the clinical director for one of the district streams, which includes the aged health services and a number of community services for isolated, frail, vulnerable people. In our local health district, we have almost 50 residential aged care facilities and almost 5,000 residents of those facilities. And I'm very proud that within our clinical stream, we have one of the best residential aged care health outreach teams that's operating in the state at the moment. And team members have been working with Jo and her group to develop policies. We've been we've been fortunate that we have not had anybody with COVID in any of our local facilities, but we've managed a number of situations where staff members or contacts of staff members have been COVID positive. And we've also had staff in my own hospital who have contracted COVID and resulted in a major lockdown last September. Again, no patients in our services were affected. It is a very worrying time. I think people should understand, though, that this is a very nasty virus. It is very infectious, very transmissible, and that the lockdowns that are in place in the community and in the residential care facilities are absolutely essential. We know from experience in Victoria that if COVID gets into a facility, about 1/3 of the people who contract COVID, who are residents of aged care facilities, will succumb. And that is absolutely frightening. So we must imply all reasonable measures to maintain the safety of the residents.
Thank you very much. Thank you very much, John. Now, as I mentioned earlier, we received a lot of questions from you when you registered for today's meeting. So we're going to go through them right now. Now, we've split the questions into the following categories: vaccine rollout update, visitation and staffing, consent, wellness, and advocacy and rights. But many of the questions were very, very similar. So you may hear your question asked just slightly different to how you worded it. And they all came through to us anonymously as well. So let's start with the questions regarding the vaccine rollout. Lisa, if I can start with you. Last night, the Prime Minister announced that the National Cabinet had decided that it's now mandatory for all aged care staff to be vaccinated. Would you like to just speak to that for us, please?
Yeah, sure. Thank you, Carl. Yes, so yesterday, National Cabinet agreed that the COVID-19 vaccination of residential aged care workers will become mandatory from mid-September this year. And so what that means is all residential aged care workers must have received at least one dose of the COVID vaccine by this time. And the COVID-19 vaccination will be mandated as a condition of working in an aged care facility, and that'll happen through shared state, territory, Commonwealth authorities and compliance measures. So the strong advice from the Australian Health Protection Principal Committee, that's AHPPC, I'm sure everybody's heard of that. That's our national group of experts. They have been strongly encouraging the whole way through to aged care workers right from January to get vaccinated. And we know that right now, just over a third of our aged care workers are reporting that they've received a COVID-19 vaccine. So we're really encouraging all aged care workers to get fully vaccinated as soon as possible. There are some things that we're doing to support that. There'll be a new $11 million program that will open shortly, and that's going to provide additional support for aged care workers to attend off-site vaccination clinics and go to general practice. And we know that vaccination is the greatest protection that we can offer against COVID-19.
Thank you, Lisa. Can I just stay with you, though, just for a moment? I've got a few questions for you on the rollout. Can you just give us an update on where the vaccination rollout in aged care is up to in New South Wales, and which vaccine is being administered?
Sure. Thanks, Carl. So in terms of what the Commonwealth's doing, the Commonwealth's aged care program, we're delivering COVID-19 vaccine clinics to 883 aged care facilities in New South Wales. And when we talk about our vaccine rollout, we talk about first dose clinics and second dose clinics, because as we know, it takes 2 doses, regardless of currently, for the vaccines available to get the full benefit of the vaccine. So all of those 883 have had their first dose clinics. And in fact, all but one have had their second dose clinics, and that one will be completed this week, which we feel very, very happy about. So what that means is that we've now safely vaccinated over 53,000 residents in aged care in New South Wales, and all of those residents have been vaccinated with the Pfizer vaccine. We're doing a little bit more in response to the current situation in New South Wales. There's 94 aged care facilities across 7 local government areas. So they're residential aged care facilities that would fall into the City of Sydney, Bayside, Canada Bay, Inner West, Randwick, Waverley and Wallara. And there's 94 RACFs in there. And while all of those facilities have had their second dose clinic, we do know that there will be some residents and workers who are yet to be vaccinated. And so the purpose of these clinics is to go back and to offer the Pfizer vaccine to any residents or workers who are not yet vaccinated and wish to receive a vaccine. So we're intending to run those clinics over the course of this week and hope to finish those by Monday of next week. Once we've done that lot, there are a further 144 aged care facilities in some different local government areas that we'll also be going back to. And they'll be in the local government areas of Blacktown, Camden, Campbelltown, Canterbury-Bankstown, Cumberland, Fairfield, Liverpool, Parramatta, the Hills Shire, Wincarriby and Wandilly. So all of those 144 facilities, except one, have had their second dose clinic, and that one is scheduled. So we made decisions about where we're going to go for these roving clinics and to prioritise them based on advice and consultation with New South Wales Health. So it's really about the risk profile of those areas. All of those residential aged care facilities in those areas are being contacted by our vaccine provider teams who will be organising the clinics so that facilities can organise consent for their residents and workers. So if you're in one of those areas, your facility will let you know when those clinics are going to be taking place. And residential aged care facilities can contact their local public health network for more information. We strongly encourage all of the residents and workers in those facilities that are not yet vaccinated to take up that opportunity.
Okay, I'm just going to pull a couple of things out there just for clarification. Where can staff who work in aged care get vaccinated, and will they be getting the Pfizer to speed up the process as well?
So anybody that's at one of those residential aged care facilities in those areas that I just mentioned, those roving clinics, we're very happy to vaccinate staff through that process, and all staff receive the Pfizer vaccine. So in terms of what's been happening more broadly for staff, when we do our normal in-reach clinics, so when we go out, our first priority is to vaccinate our residents because they're our most vulnerable group and we want them to be safe. But where we've got leftover doses, we've also have been providing those to staff. And in addition to that, aged care workers have a number of other options. So for workers under 60, they can access the Pfizer vaccine, and they can do that at state and territory and Commonwealth vaccination clinics. Mm-hmm. And we've also got some dedicated aged care and disability worker clinics located in Blacktown, Campbelltown and Macquarie Park. So if there are staff out there listening that are interested in getting a vaccine, your facility will be able to connect you with the booking details for those clinics, which are just for aged care and disability workers. For people that are aged 60 and over, they can access the AstraZeneca vaccine at the state and Commonwealth vaccine clinics, and also by going to see their GP.
Thanks, Lisa. There was a specific question that you have covered, but I just want to go over it just so they know that they've been heard. For residents that have only just gone into aged care, they missed their first dose of the vaccine. How can they catch up? Should they wait for a roving clinic to come around, or is there a faster way that they can go about it?
So there's a couple of options. So we've got the roving clinics, and they'll pick up people that are in those areas, but of course that's not going to cover all the different residential aged care facilities. So if that's not available, what will happen is your facility will work very closely with your local primary health network to organise another option for you. And that might involve a GP coming to the facility, or for people who are mobile and able to leave the facility, it might be attending a state-run or a Commonwealth vaccine clinic. We know that there'll be people who have recently entered aged care who will have received a first dose of AstraZeneca in the community. And for those people, your facility will work with your primary health network to organise that for you. And we do really strongly encourage, if we've got older Australians living in the community, we do really encourage you to get vaccinated as quickly and safely as possible before you enter aged care.
Absolutely. Is there any way that a resident or their representative can find out when the roving clinics are going to be coming to them?
Yeah, so just ask your facility. So we've just been organising the scheduling of those clinics over the last couple of days. Facilities are being contacted as we speak to let them know the date that they can expect. If they haven't heard yet, they'll hear very shortly. So ask your facility manager, who should be able to tell you.
Right. Just one more question on the roving clinics. Can staff members bring their immediate family members to the roving clinics when they come to their place of work?
No, look, I'm sorry, we're not able to offer that. The roving clinics are only offering vaccine to residents and workers. So for family members, they can access the COVID vaccine in the community through all of the other channels that are available.
Great. Thank you, Lisa. John, I'll go to you now. What is the evidence that getting a COVID-19 vaccine will protect mum and dad? This is one of the questions that was pre-submitted.
A key question. I'd just like to comment first that the second round vaccination program that Lisa has described is extraordinarily important. Mm-hmm. In our local health district, the rates of uptake of residents vaccine for the first round vaccination have varied between 36% in some facilities and almost 100% in many. So it's extremely important that those who have not been vaccinated have the opportunity to receive the vaccine. I'm sure Professor Kidd is more across the answer to your question than I am, but the vaccines are very effective. They have very high efficacy rates, equivalent between the two vaccines that we have available in Australia at the moment. They stop people from dying. They stop people from needing to go to intensive care and needing to have ventilatory support. They stop people from needing to come into hospital, and they stop severe disease. And there is increasing evidence here locally recently, the West Hoxton Park party cluster, and in the UK and other places, that if a person is vaccinated, they are less likely to even if they suffer mild disease, they are much less likely to spread COVID to people whom they encounter. So there's extraordinarily strong evidence, and it is just amazing that these very effective vaccines have been developed so quickly. It's a credit to those involved in vaccine development.
Thank you very much. Michael, how do you prove that you have been vaccinated? Will we receive a record of completion once we've had the 2 doses?
Yes, thanks, Carl. So when you've completed your 2 doses, you'll probably be given documentation at the place where you've been vaccinated, but also there's an electronic record as well. So all doses of vaccine, the person giving you the vaccine is required to enter that into what we call the Australian Immunisation Register. Mm-hmm. And that's information also gets passed through to your My Health record. If you have a My Health record, an electronic health record, which about 90% of Australians have, but also it goes through to your Medicare record. And if you have the Medicare app on your mobile phone, you can actually open up your certificate showing your vaccination record. And at the moment, it includes details of your COVID-19 vaccines, says whether you've completed your course with the 2 vaccines, and also includes the details of your influenza vaccine as well, which you may also need in order to access aged care facilities in some parts of the country.
Thanks, Michael. And we've put details on how you can get your immunisation record into the Q&A chat box for you. Lisa, a question came through. Rules do keep changing. How can I find out when my family members will be eligible for their vaccination?
Thank you, Carl. So the best thing that people can do is to go to the eligibility checker, and that's on the Department of Health website, www.health.gov.au, and we update the eligibility checker all the time to make sure that it's consistent with what the rules are. So that would be where I would go.
Excellent. And once again, we've put the link for the eligibility checker into the Q&A box for you right now. Michael, a question for you that came on through. I am over 60 and I want to be vaccinated as soon as possible, but have lost confidence with the AstraZeneca vaccine. What are my options and what are my rights?
Thanks, Carl. So at the moment, the vaccine that's available to people aged over 60 is the AstraZeneca vaccine. The Pfizer vaccine is being used on people aged under 60 years of age. The vaccination, of course, is voluntary.
We might, we'll come back to that.
We are able to, older Australians do get vaccinated because this will, I dropped out? Okay.
Yeah, you dropped out.
It's important that people get vaccinated. Okay, thank you. It's important that people aged over 60 do get vaccinated because people aged over 60, as John has said, are the people most at risk of developing severe disease and being at risk of dying from COVID-19. So far, we've had more than 2/3 of Australians aged over 60 who have received at least their first dose of the AstraZeneca vaccine. And now, as weeks pass, more and more people are getting the second doses 12 weeks after the first. So my encouragement to you is to get vaccinated. At the moment, as I mentioned, the Pfizer vaccine is not available to people aged over 60, except in some circumstances. So it is available as part of our rollout into residential aged care because we've been wanting to fully vaccinate people in aged care very quickly, and we can do that in 3 weeks. With the Pfizer vaccine, with the AstraZeneca, it takes 12 weeks. But I urge people aged over 60, please get vaccinated.
Thank you so much, Michael. John, a question came through. Where can we access information about the effects of COVID vaccinations with other medications? For example, depot psychiatric medication.
Let's start off with your local doctor. I think our GPs are very well informed about the effects, side effects, interactions, and mode of administration of the COVID vaccinations. Local pharmacists are another good source, and there are reputable websites that you could access. I would suggest you go in through the Australian government links or the CDNA link, and you'll find the information there. But start off with your GP. I'd comment though that there seem to be very few significant interactions between the COVID vaccinations, Pfizer or AstraZeneca, and other medications that we may be taking.
Thanks, John. While you're there, I've got another one for you. They've written, my father had 1 dose of Pfizer earlier this year, but unfortunately then went into hospital. While in hospital, he missed out on his 2nd dose. I did let the doctors and nursing staff know, but they're unable to help. When he returned to the facility, he saw a doctor and they advised it was now too late to have the 2nd vaccine and couldn't start on the AstraZeneca. What should he do?
I would have administered the 2nd dose of Pfizer. I think the recommended interval is what it is, but there is some leeway. So up to 6 or 8 weeks following the first dose, there's evidence that the second dose is still effective. And there's probably going to be evidence coming through that subsequent doses given at greater intervals are also going to be of benefit. And I haven't seen the scientific papers, but on the news bulletins this morning, there were reports of benefits from even combinations of different vaccine types given at different intervals. So I would proceed to get the second dose.
Thank you very much. Michael, a question for you. In terms of vaccination, it seems a lot of attention is given to the population of capital cities, while many rural towns and communities have limited access to the vaccine. My GP says he only received 50 doses a week. In a town with a population of 8,000, it'll take 3 years to get everyone done. What's being done about this?
Yes, it's really important, and it's one of the components of the National Vaccination Program that we have equitable access to vaccines wherever you are in Australia, which means it's very important that we are getting vaccines out to people in rural areas and into remote communities across the country as well. So some general practice, there are general practices in many towns across Australia, many rural towns, which are vaccination centres. In fact, we now have over 5,000 sites where people can get the vaccine across the country. And initially, many of the general practices received 50 doses a week, but with more and more supply, we now have practices getting between 400 and 600 doses a week of the AstraZeneca vaccine. In addition, starting from next month, from July, over 1,000 general practices will also start to administer the Pfizer vaccine. Now, this is very important in rural communities because most of the places where people have been able to get the Pfizer vaccine have been in the major hubs in the capital cities. But as we roll out to over 1,000 general practices, and particularly in rural areas, this will make access to the Pfizer vaccine for those aged under 60 much simpler and quicker as well. So it is a very important part of the program, as I say, Kyle, to make sure that people are covered no matter where in Australia they're living.
Thank you, Michael. While I've got you, another question came through. I'm over 60 and had the AstraZeneca vaccine. Will I require a Pfizer booster next year?
Yes, that's one of those questions that we currently don't know. It's possible, and in fact, it looks more and more likely that we will need some sort of booster vaccines in the future. So if you've had, as you've just said, you need your 2 doses to be fully vaccinated with either AstraZeneca or with Pfizer. And over time, we'll let you know what the requirements are next year. It may well be that we have new vaccines becoming available, which are even more effective against whatever new strains of COVID-19 develop over time. As you know, at the moment, we're watching very closely. We're very worried about these new variants which appear. At the moment, it's the Delta variant, which is predominantly breaking out in Australia. And there are new vaccines being developed which are going to be even more effective in providing protection against those new variants. The other thing we don't know is how long the immunity lasts if you've been vaccinated. We do know that you need 2 doses in order to get a sustained immune response, but we don't know how long that's going to last. So it may well be like we currently have with influenza, that you need a booster every year or so in order to keep up your protection against COVID-19. And of course, this is going to become even more important as our borders open and we start opening up to the rest of the world.
Thanks, Michael. One last question for you on the vaccine rollout. I work in a residential aged care facility and I'm pregnant. Can I still have the vaccine?
Yes, so ATAGI has looked at this, the Australian Technical Advisory Group on Immunisation, and there's advice on the Australian Government Department of Health website. We are recommending vaccination for people who are pregnant when it is your turn to receive the vaccine. There's been now a lot of work overseas looking at the safety of the Pfizer vaccine in people who are pregnant. Also, what we know is that if you're pregnant and you are infected with COVID-19, that does put you and your unborn baby at increased risk. So it is important that we are protecting women who are pregnant. And of course, this has been happening through the last few months while we've been rolling out the vaccine, because many of the healthcare workers and quarantine workers who've been in the early phases of being vaccinated are women who are pregnant.
Thank you for the clarification, Michael. We're going to move on now and start looking at some questions related to visitation and staffing. There were many questions that were very, very, very similar on this theme. Joe, just to start off with, can you clarify what are the restrictions for visiting people in facilities that are in Greater Sydney at the moment?
Sure, I can. So currently, if you're in a facility located in the Greater Sydney, which includes the Blue Mountains, Central Coast, Wollongong and Shell Harbour, under the Chief Health Officer's advice, you must exclude all visitors, excepting those that are providing things like essential caring functions. So that would include end-of-life visits. You need to ensure that all staff and essential care visitors wear surgical masks, and there is some additional advice around reasons when masks can be removed, and that's available on New South Wales Health website. And all essential visits as well must be in the residence room. And also facilities need to ensure that residents are provided with appropriate PPE, so personal protective equipment and infection control advice if they need to leave the facility for any essential purposes. For all other facilities located in New South Wales, so outside of those areas, all staff and visitors must wear a surgical mask. And again, there is additional advice around when they can be removed, and only 2 visitors allowed each day as well. So all of this information is available on the New South Wales Health website as well.
Thank you, and we'll put a link for that in the Q&A box as well. Joe, just to follow up, because many people have asked it, if residents are all vaccinated, family members are all vaccinated, staff are all vaccinated, then why are they still not allowed to just go and visit their loved ones during a lockdown period?
That is a good question, and it's probably one more for perhaps Professor Kidd or Dr. Cullen, but I think that it's important to note that, with the vaccination, while it provides protection, it doesn't protect all of us from getting the virus in the first place. As Professor Kidd's outlined, it does decrease the severity of the illness and prevent potentially hospitalisation. So I think from a New South Wales Health perspective, what we kind of work with is what we call a hierarchy of controls. So they are things like, we want to ensure everyone is vaccinated. We want to ensure that we've got these that advice in place that limits things like visitation and protects residents and staff as well, in terms of really locking down facilities, which is unfortunate. That we have appropriate testing, access to testing in place. So we've really focused a great deal on ramping up our testing, making that accessible and available. So that includes, we're really aware that people in the community who I'm going to call vulnerable, but that's not meant in a negative way, but our testing services, our drive-throughs, our clinics, our immunisation facilities are all accessible for everybody in the community, no matter who you are, where you come from, and how you walk through your life. So there's some of the things. All of those hierarchy of controls are important at this point in time with the kind of pandemic that we're in.
Thank you, Joe. Marg, can I bring you into this conversation? What if someone does want to visit during the lockdown, though? What can they do? What should they do?
Yeah. Look, I think the most important thing, and this is really coming out now, isn't it, as we've been talking, there is a lot of information out there. So the first thing you have to do is be informed. And you do that by keeping up to date. And people have already referred to New South Wales Health and the Department of Health websites, and they've been put up on the screen. And we can't encourage you more, more emphatically, is to keep up to date, because already we've shown that the situation is changing rapidly from day to day. And so you can't assume what applied a week ago may apply this week. So that's the most important thing, is you must be informed, because what we're doing is we're balancing personal well-being with human rights here, and they're often contradictory sometimes. So I want to also refer you to the industry code, and we'll be putting a link up to that. That's a set of guidelines as to why restrictions are put in place, and what those restrictions might be in certain areas and certain infection areas. But I think the thing that's come out of today is that no one area is the same. And so this comes back to what I said before. Please be informed about what is happening in your area, because it won't be the same as maybe your cousin down the coast or something like that. So the most important thing, if you want to visit, is to contact your aged care home, your residential aged care facility. Understand their policies and procedures, because it's their responsibility to communicate that to you, and for you to understand and respect those, because each individual aged care home will have a policy in place and will clearly explain that to you, so that you can understand whether you can visit or not, because the reality is you may be restricted for visiting for a certain amount of time.
Thank you, Margaret. Joe, can I just bring you back in? I just caught a question on a live question that came through, just for clarification. The question was, do you need to be vaccinated, fully vaccinated, to be able to visit?
Yes, I think we haven't mandated that in New South Wales, but it's really up to the individual facilities to make that decision. But I think definitely having a COVID vaccine and a flu vaccine is recommended. Obviously, individual facilities screen visitors, but under the current sort of advice that we've got in place, visitors are currently excluded anyway, but absolutely highly recommended. Yeah.
Thank you. Michael, a question for you. Now that we are in lockdown, are staff still able to work across different facilities? And once New South Wales comes out of lockdown and restrictions ease and life goes back to normal, will staff be able to then once again work across various facilities? And if so, why?
Yes, so I've just got to refer to my papers here, because we have restrictions applying in each of the states and territories where the outbreaks are occurring at the moment. So from last Wednesday, the 23rd of June, aged care providers in inner Sydney were asked to move to single site worker arrangements, which meant that people were only able to work in one site. They weren't allowed to work across facilities. That was extended on Saturday to all the providers in the Greater Sydney area, the Blue Mountains, Central Coast and the Wollongong and Shell Harbour areas. So this means that people can only work in one facility during a period of high risk. And that's been set initially for the next 2 weeks, but it will most likely be extended further. And that's so that we don't have the risk of somebody who is infected with COVID-19, even if they've been vaccinated, working in more than one site and putting residents in more than one site at risk of being infected with COVID-19. We have to remember that not every resident has been vaccinated. Some people have not been well enough to be vaccinated. Some people are very frail, and some people who are very elderly may not get a strong response to the vaccine. So as Joe is saying, we have this hierarchy of protections in place to protect our most vulnerable Australians, and this is one of them. Now, once the outbreak is brought under control, once we have no further community transmission of COVID-19, then we revert back to normal arrangements. And we may well have staff who are working in more than one facility. And there's no risk at that time because there's no COVID-19 in the community. But then once we get another community outbreak, then those measures come back into play. It is complex because we do have health professionals who do visit more than one facility. For example, general practitioners may have patients in more than one residential aged care facility. Podiatrists and physiotherapists may be providing fantastic care to people in a number of facilities. Agency nurses may be working in different facilities, filling in when there are shortages of workforce. And of course, that's essential as well. So it is a complex arrangement. I know that some people say, well, you should just work at one place, but that's actually not feasible in many circumstances.
Thank you, Michael. Janet, I've got a question for you. They've written, my mother's home is already under-resourced. How can staff assist with residents who are unable to operate an iPad, for example?
Well, let me start by referring again to something I think that you mentioned, Carl, the aged care quality standards. These are standards set out in the law, the Aged Care Act, which every single residential aged care provider is required to comply with. And if you're not familiar with the standards, then I commend them to you. You can find them in an app. If you want to Google them, you can actually load them onto your phone, or you can certainly find them on our website. And embedded in the standards are a series of expectations or requirements of aged care providers in relation to staffing, and they are in Standard 7, Human Resources. We expect that in response to taking money from the Commonwealth Government to deliver aged care, so being an approved provider comes with an obligation to ensure that there's adequate staffing to meet the needs and the changing care needs of residents, irrespective of whether there's a pandemic or they have changes in their personal needs over time. Where a resident requires assistance to maintain social contact with their loved one, we would expect a provider to have sufficient staff available to meet those needs, along with the other care needs of residents. It's just like any other care need. Now, Joe talked about the public health order currently in place, applying to the Greater Sydney area and providers in that locale. And there are exceptions to the general principle that there should be no visitors at this time of heightened risk of transmission. And those exceptions have to do with visitors who are family members with a particularly strong connection to a family member in care. And people can read about the definition of those exceptions online. The Commission refers to those individuals as partners in care, and it's a recognised category of family, typically a family member, who visits typically daily, may participate in assisting with meals or some other form of personal care that they deliver and that is really important for that loved one in care. Those partners in care, under the public health order currently in place in New South Wales, should have continuing access to their loved one, but they have to negotiate that with the aged care provider, because there's a clause in the public health order which says, rightly, a decision whether to admit an excluded visitor, which is somebody providing essential care, should be based on a risk assessment by the facility. So the facility gets to make that call. So a family member who considers that they have that relationship with somebody in care should have that conversation with the manager on site, or ring them, have a chat with them, explain your particular circumstances, and seek their assessment and guidance on how you might access that individual to assist them, for example, in going about daily living tasks and so on. But going back to the fundamental question, Carl, if they need help in operating an iPad, then we would fully expect that staff would be in a position to provide that assistance, or they would find another resident who is very amenable to the idea of assisting a resident in using that technology.
Thank you, Janet, for that. That was very interesting. we did have a live question come through. Could you please provide a definition of partners of care?
Well, I can, but it really turns on the public health order. As Joe has set out, the public health order, the state chief health officer's public health order, governs access to aged care services in times of the pandemic. So what the public health order says, and you've been provided with the link to it, is that in general, visitors are not able to access an aged care service, a residential aged care service. However, there are some exceptional categories, and they include, I'm just turning it, facilities located in Greater Sydney, including the Blue Mountains, Central Coast, Wollongong and Shell Harbour, must exclude all visitors except those providing essential caring functions. Now, the definition of those providing essential caring functions include an essential care purpose can include people visiting their loved one who are receiving end-of-life care or visiting a resident with a serious mental illness, including advanced dementia, where the resident requires a trusted carer to support and maintain social and emotional well-being. An essential care person is someone who has frequently and regularly visited a resident to provide aspects of care and companionship to that person. An essential care person is not a casual visitor or visitor not providing an aspect of care or visitor who the resident does not want to have assisting with their care. Now, a decision to admit a person providing essential care is made by the facility based on an assessment of the risk posed by the visitor and the ability of the facility to manage their visit. So in every instance, a family member who considers themselves to be essential carers should approach the on-site manager at the service where your loved one resides and have that discussion with them. Put forward the basis on which you consider that you do need to access your loved one in person and allow the facility to consider the risks and how they might manage those risks.
Thank you for that clarification, Jenna. I'm just going to open to the panel if anyone else wanted to say anything on that point before we move it on.
Yeah, Carl, I might just quickly jump in. I mean, if people, as Janet said, have tried those avenues with their provider and they're having issues, that's the time to give Marg and her team a call on 1800 700 600 to help with some additional tips and tricks, some advice about how to have those conversations. So just to know that the advocates are there ready to help as well. And that it is a balancing act here on some of these things, but they've been very successful in talking through some of these options and talking to providers. But providers are definitely the first port of call. Thanks.
And just on the back of Craig's point,
yes.
The commission I lead also has a complaints line. So if people have those conversations, engage with OPAN and continue to be frustrated in what they consider to be a legitimate request that they're making of the aged care provider, then they can contact the Commission by phone on 1800 951 822. Say that again, 1800 951 822. Or you can go online and use one of our web forms to submit your concern to us, and we will get in touch with you and see how we could assist.
Thank you, Jana, and we will put that phone number and the link into the chat box for you as well. Michael, we sort of on a similar topic, I realise how short-staffed the facility is that my father is in. What will happen when staff go and do the right thing and get vaccinated and then are unwell and need to take time off? How will they know that Dad is going to still get the care that he needs?
Yes, it's a really good question. It's one of the reasons why many of the facilities are not vaccinating all their staff on the same day because of the risk of a number of people having side effects the 24 to 48 hours after the vaccine, particularly with the Pfizer vaccine. A percentage of people will feel quite unwell the next day. It's nothing to worry about. It passes very quickly, but it can mean that people are unable to work the next day. So each facility is responsible for ensuring that they have adequate levels of staffing and that they have provisions in place to make sure that the care of residents is not going to be compromised as a result of the vaccine program. Might be something that Janet would like to speak to as well, Carl.
Janet, as a regulator, what would you expect to see?
Fundamentally, I would expect to see that the employer, the managers, are engaging with staff and discussing with them their plans to access the vaccine, the timing of that access, in order that they can ensure that they have rosters which are filled and have the potential for substitutes or relief staff coming in if there are some people who feel the need to have a short period of time, a half day or a day off work if they're unwell immediately following the vaccination. So this is part of normal staff planning. A proficient aged care provider managing a staff roster should be engaging with staff all the time about expected periods of leave, the prospect of or the risk of somebody not being available to fill a particular shift, and then having spares, effectively a relief pool on whom they can draw if they find themselves short-staffed on a particular shift. That's part of managing an aged care service.
Thank you, Janet. Joe, what are standard procedures for being able to see our loved ones during COVID who are reaching the end of life? Are we allowed to be with them in their last days and hours? You did touch on this before, but if you could just clarify.
Yeah, I will. So again, if you look on the New South Wales Health website where the advice is around the public health advice from our Chief Health Officer, you'll see a link through to exceptional circumstances. So that's circumstances where you might be allowed entry into facility on compassionate grounds. So, for example, imminent death of a loved one, or, as Janet said, where you're providing essential care. And similar provisions exist for staff members as well, where that would result, so not allowing entry would result in a significant compromise to patient care. So the decision is based on a risk assessment of the individual, the ability of the facility to manage the visit, and so visitors and staff, for example, who have symptoms of COVID or who have been identified as a close contact should not be exempted. So they would definitely be people that you would not expect to be admitted into the facility. So I think that in addition to all of the ways to access advice and information, there's also a phone number on the website in that exceptional circumstances to your local public health units. It's a 1300 number. So I definitely encourage facilities to call that number as well. So you're definitely not alone in that decision making. I think it's good to make these decisions if you feel unsure, hand in hand with your local public health unit. And also, I think individual local health districts have excellent, it varies around the models that local health districts use to engage with the residential aged care facilities around support. But I know, for example, in Dr. Cullen's district, Sydney Local Health District, they have a very strong and well-connected in-reach program as well. So, where you've got connections and pathways and relationships with your providers, then I would be reaching out as well if you're unsure. But definitely that local public health unit number, 1300 number, is definitely a way to just check your advice and check your thinking if you're unsure.
Thanks, Joe. Janet, are aged care providers able to apply heavier restrictions to visitors than those outlined by New South Wales Health?
Are they able to? Well, some do, and I expect that's probably the source of the question. It is a matter of concern to us where they have blanket provisions denying access to any family members. And as you've heard from my recitation of the public health order extant in New South Wales, even the Chief Health Officer of New South Wales recognises the need for exceptions to be made and for the risks to be managed when individuals are indeed provided with access to their loved one in care. So where an aged care provider has effectively imposed a blanket lockdown with no exceptions. We are concerned about that. We are very pleased to hear about that because we would regard that as a complaint about the service, which we would be happy to take up with them. And indeed, Craig, I'm sure, also would say the same thing in relation to OPAN services. It is an interpretation which may be based in good intentions. And I think we have to give providers that many providers are very concerned about levels of risk. They may not have a fully vaccinated workforce. In fact, many of them do not yet. They may, in fact, have numbers of residents who have yet to catch up with the second dose. And so they are very exercised by managing the risk of that the virus might come into their service. The counterweight to that is the risk that many families online would also recognise, which is that individuals who are in forced isolation have a psychosocial response to that. They can become distressed, they can become anxious, they get lonely, they can become depressed. And in the Victorian outbreak last year, we saw aged care residents in a number of the homes which were subject to lockdown experiencing those sorts of difficulties because they were in lockdown for weeks and sometimes months. So we are equally determined that providers understand those risks and take all necessary steps to ensure that residents in a service remain connected with their family members. It might be mediated by technology. It could be that it's iPads. You can have all sorts of visiting arrangements which do not bring a family member into close proximity with a residential, an aged care resident. And we have any number of good examples where providers put in place the wall and allow a resident and a family member to communicate, seeing each other through a window using mobile phones. There are so many ways of facilitating continuing engagement between a family member and somebody in care. And we are looking for providers to understand the risks of managing that isolation and that loneliness and ensuring that they are mitigating those risks at every turn.
Kyle, I just add in there, I saw the team did put up the number for the Centre for Grief and Bereavement. There's some specific services that the Commonwealth Government have funded to support people in residential aged care who want to talk to someone. There's also the Older Persons COVID support line that are there to talk to people as well. So I really encourage your family members there or people are there themselves, are residents listening to this. There are people you can talk to and reach out and have a chat about what you're experiencing at the moment as well. Really, we want people to stay well and to stay safe, but to keep up their function and keep up their mental well-being as well.
Absolutely. Thank you very much, Craig. In fact, we're going to move on to questions on this very topic of wellbeing right now. Look, we've received some important questions on this topic. A lot of the questions coming through on the Q&A are on this topic. You'll see that there are similar themes coming through them. So whilst we won't be able to answer every single individual question, please do listen to the advice that is given because you will be able to apply it in most cases to a situation that you're going through. So let's have a look at a couple of examples now. Craig, how do aged care facilities ensure aged care residents' emotional and physical needs are met during lockdowns? This is a big one that's been coming through.
It is. And some,
I was going to say, particularly for those people who are living with dementia as well. It's really
yeah. So there's Dementia Services Australia, particularly for those with dementia, and they've been putting some information out over the last couple of days as well. So I'd encourage people to go to Dementia Services Australia website, Dementia Australia. It is really important to keep that connection. So continue to write letters, to continue to get the grandkids to keep connected as well. Doing things like Janet was talking about, going and seeing people through the windows, so important so people can still see a face. But providers themselves will be looking at ways to still keep people connected, keep people up and walking. Some facilities last year we saw put in increased physical exercise. We saw some great examples of people coming out of rooms and doing the bingo on their trays and that sort of thing, still keeping the social distancing, but still keeping connected. So it's so important. If people have got other ideas, I'm sure the facility would love to hear them as well. But I think providers are looking for ideas to keep people up and moving and active, which is so important, as well as the mental well-being as well.
Thanks, Craig. Janet, look, just to follow up on that question, as I said, we are receiving a lot of comments and questions about the effects of lockdowns on people living with dementia or with cognitive decline. And we know that when these restrictions, to residents are in place, there can be a deterioration in their physical and mental function. What should providers and families be looking for, and what can be done about this, do you think?
This is a conversation I have with the Chief Clinical Advisor who works in the Commission, who is in fact a senior geriatrician who also works in public hospitals. Let me give you her list and then we can talk about it. So the sorts of things that Dr. Roth would point people to would be a decline in independent function, or reduced participation in usual or pleasurable activities, reduced interaction, even withdrawal. Manifestations of depression, such as negative or pessimistic conversations and comments. Just something like a lack of laughter or pleasure, where you know and enjoy your family members' sense of humour and enjoyment in life, and you're not seeing it any longer. Anxiety or distress, if that's manifested, they might lose their appetite and they might experience weight loss. And there may be other changes, subtle or more obvious in behaviour. So unexpected cognitive decline, where they're no longer able to understand certain things or perform some simple tasks, or possibly even behaviour problems where they start to become a bit aggressive or they lash out at people. They can all be signifiers of distress and potential decline associated with isolation, with lockdown. Now, we would expect all staff in an aged care service to be alert to those signs and symptoms, but family members too. To the extent that a family member keeps in touch with their resident, and we hope that everyone online does, through phone calls, through iPad conversations, through window meetings and so on. You can also, you know your loved one, your mum, your dad, your aunt, your sister, better than anyone. You can see these things, you can be alert to these changes, and that's when you have a conversation with the care staff or the care manager. Say, look, mum seems a bit off colour, or mum seems to have lost a bit of weight, or what's happening with mum's meals? Is she being assisted? Because it looks to me as if she may not be eating enough. That sort of thing. That's the question you can ask. And if the care staff haven't noticed it, then you can on their behalf. And you would therefore expect them to take action on that. It's being alert to the small changes that we know and can recognise in the people we love, which are going to assist the care staff in delivering the sort of quality and safety of care which your loved one deserves.
Thank you, Janet. Marg, what supports are there available for residents and their families who are suffering from social isolation caused by the latest lockdown?
Yeah, Janet and Craig have just about nailed it, everything I would have said. But, you know, basically what Seniors' Rights Service and OPAN does provide is that advocacy link. So someone to talk to if you've noticed that something's wrong and you're not feeling that you're being heard at the aged care facility, or you're not sure how to communicate with the aged care facility, then certainly use the resources of the advocacy service, because the advocates are there to listen, go through, you can talk through the issues that Janet has just outlined and say, look, I've noticed this, but I'm not sure I'm being heard. I'm not sure how to contact the aged care facility, or I need assistance to talk to the aged care coordinator or the care manager, or maybe even just the recreational officer who organises the activities. Whatever it is, you can chat through your issues, your concerns with an advocate. They can listen to your concerns and maybe come up with a lot of solutions or ideas, you know, the ones that Craig outlined earlier about what we've heard about in other aged care homes. And you can take those, or we can take those to the aged care facility. And that's what I found in the last outbreak, was that, you know, quite often by coming to the advocacy service, we were able to share our knowledge from other aged care providers, because, as Craig said, some of them are very good at it. And some of them have put in some very innovative ways of organising the communication and putting in alternative communications and ensuring that communication doesn't fall down. So we really encourage you to come to the advocacy services with your concerns. We'll be able to talk you through it and then maybe give you some advice and some hints, or talk to the aged care provider on your behalf. But certainly that's the support that's available to you. There's someone to talk to and someone who can talk on your behalf if you feel you want them to.
Thank you, Margaret.
Yes. Can I, sorry to interrupt, but just coming in,
Please.
I just noticed something on the chat line which is easy to address. There was a question which was, I routinely visit my loved one in care on a daily basis, I think, but we can't now because of the stay-at-home orders. Joe, please come in and back me here, but my understanding of reading your public health order is that that is an exemption, that somebody who routinely, that is daily, visits an aged care home to spend time with their loved one and assist in their care is able to continue travelling for that purpose. Is that right?
Well, again, it depends on that sort of risk assessment at the time, where the person is from, if they come from a current area that's, one of the areas that's part of the public health advice as well. And then, obviously if they're a close contact. So it is a case-by-case basis as well. So that's where it's important that, like everyone has been saying, that connection's made and the conversations happen and the risk assessment's made. And we're just sort of talking, so we're all comfortable that, we're supporting the health of the resident, and obviously that's critical. That's been a really big focus for us in our emergency response planning to ensure continuity of care, but we don't want to make situations worse or do any harm as well. So I think, again, I think it's a really on that case-by-case basis in New South Wales, to be honest with you.
Joe, this is a question that came through on the live Q&A. Would you have a definition of, or could you tell us what is considered essential care?
I'm just looking at I know it's a bit hard to define, isn't it? So, and I can't look. What I'm going to say, I think that's where I'm making the point around case by case. So if you look at the advice, we're talking about things like, compassionate grounds. So, if your loved one is about to pass away, or there's palliative care in place, so those sort of things, obviously. And then, essential care is really about, essential care. So we're not stopping, people being transported to hospital. If an ambulance needs to come in and they need to go, it's clinically advised that then people need to go to hospital, then that will happen. Things like dialysis, so renal dialysis, those sort of things where that is, essential care to continue a quality of life and to continue that sort of continuity of care. So those sort of things are essential. John, did you have anything that you wanted to kind of add in to my assessment of essential care?
I agree that it's case by case, and the request should be approached with an open, practical mind. Like also just to add to Margaret and Janet's comments, that sometimes when older folk do become withdrawn, it can be a manifestation of a serious depression. And sometimes, not always, but sometimes the review of a GP or referral to an outreach, in-reach team which has access to old age psychiatry and psychologists can be helpful in those situations as well. So we do need to approach these circumstances with very, very broad vision, and be able to identify a number of interventions that might assist.
Thank you, John. Joe, while I've got you, a live question has come through from Merrin, and it's quite an important one for us to clarify. Maybe Michael might need to help out as well. Merrin has commented that window visits aren't currently available due to stay-at-home orders. Are window visits actually allowed as part of essential care?
I don't know the answer to that question, to be honest with you. I think it would again depend on the kind of the circumstances and the geographic layout of the facility, I can take that one on notice and get back to you with some advice, unless anyone else wants
to
comment on
Kyle, I might jump in a little bit. When we looked at the industry code last year and developing that up, and there were times when there were stay-at-home orders, and I think there is a level of flexibility in those orders to say, look, if you need to go and visit someone and check on their welfare or their well-being, those sorts of things. So that is in the framework of both the industry code and I think in the public health orders as well. But we will send out sort of some further advice to participants in this around sort of just some clarification. We'll take that one on notice and follow up on that one.
Thank you. Thanks, Craig. Michael, we had a question coming on through. Aged care staff are the backbone of all care for our loved ones. How are staff being looked after during the pandemic, especially around vaccination, rostering, paid leave if they need to isolate or take sick leave?
Yeah, thank you, Kyle. And, just while I've got the microphone, I just want to say huge thanks to all the aged care staff who are listening, the people who are managing residential aged care facilities and the staff who are working there and providing care to our loved ones and who've been doing so throughout this pandemic for the last 18 months. And I think often feel unappreciated for the really important work that they do. It's one of the reasons why I was very pleased yesterday to see the announcement about the vaccine support grants to support aged care workers to get vaccinated against COVID-19 ahead of this becoming a mandatory requirement in September. So the ability for people who are casual employees to get paid leave, either to get their vaccine or if they experience side effects after the vaccine. I think it shows our respect for our aged care workers, and that's an important thing to do. I've been really grateful to the aged care workers at my mum's facility who've been engaging with her every day, and not just the nurses and the personal care workers, but the cleaners and the cooks, the people delivering meals, these people who are having these really important interactions with our loved ones every day.
Thank you, Michael. We're going to move on and have a look at a couple of questions about consent. Now, I am aware of the time. I think these ones will be quite quick answers. So if we could get through as many as we can, that would be great. Lisa, I'd like to ask about the procedures around the consent for vaccine. How is it given and how is it recorded?
Yeah, sure. Thank you. So in residential aged care, it's the responsibility of the facility to discuss consent for a COVID-19 vaccination. And we'd expect that discussion to happen with the resident and their family members and perhaps an appointed guardian if that's the case. And that might include organising a discussion with another health professional if there are any concerns or questions about the medical suitability of your loved one to receive the vaccine. So the facility staff are responsible for making sure that the residents and their family members have got all the information that they need to make a decision. There's some really good documents on our website that can help you in terms of thinking about the sorts of questions that you might like to ask if you're exploring issues around consent, and advice around information about how the COVID-19 vaccine can impact particularly on frail and elderly people. I really recommend that people have a look at that. We do have a consent form which can be filled out, but verbal consent is also fine. And so what would happen there is that would just be recorded in the care notes for the resident. So as long as there's a record that the discussion has been had and there's a record of decision, it's fine. The other thing I would just want to mention is that it's really important that these discussions happen with every resident, and that would include people who have a level of cognitive decline or suffer from dementia. These people will still have a view about what their wishes and preferences are, and we really encourage you to include them in your conversation.
Thanks, Lisa. Well, I've got you. A lot of residents have changed their mind since we've been having the outbreaks and now want to have the vaccine. They didn't previously give their consent. What can be done about that now?
Yeah, that's fine. So what needs to happen is the consent, the resident or perhaps a family member just needs to make sure that the facility is aware that the resident would like to receive a vaccine, and then the facility will work with the local primary health network to arrange that to happen.
Thank you, Mark. This
I just want to jump in there quickly just on that, and just for the family members that are on here. I think it's really important that we realise it's the wishes and preferences of the older person, and that they will have demonstrated that throughout their life, and probably a vaccine history and that, or not. So I think we have to also say that it's what that person wants, not necessarily me as a family member wants as well. So I think people need to think through those things and make sure that you thinking through what that person wanted to do, if they can't verbalise that at the moment. But as Lisa said, have the conversation. People using that supported decision-making process can usually indicate what they would like to do. Really important.
Thank you, Craig. We're going to talk about some questions on advocacy and rights now. I had a live question come through from Stuart for Joe. Do aged care residents have to stay in their rooms at the moment, especially if the facility has had 100% uptake by residents of the vaccine?
No, they don't have to stay in their facility. They just facilities just need to, in their rooms. They just need to come, unless, of course, they are a close contact, or there's some other reason for them to need to be isolated, or they're obviously, if there's an outbreak in a facility, we're talking about a different scenario here. But it's really, they really need to comply with that advice from the Chief Health Officer, which does not specify that residents need to stay in their rooms. Yeah.
Thank you.
It's really about limiting people coming in, to be honest with you. Yeah.
Right.
Yeah.
Marg, a question has come through. During this lockdown, I was advised I could not visit my mother. Mum has Alzheimer's, so cannot communicate other than face-to-face. How am I going to keep visiting her without having an argument every time and advising them I have spoken to Mum's advocate? How do you make aged care facilities be responsible under the duty of care for those without a voice?
Okay, look, it's pretty straightforward. Your rights have not diminished under the aged care or under the pandemic. It's if we look at the aged care rights, the Charter of Rights, a lot of them involve choices. So your rights haven't been diminished, your choices may be had. And so, but the one right that hasn't been diminished is the right to have an advocate. And so really, in this case, it seems like there needs to be a little bit of negotiation and a little bit of communication, better communication. No one should be fighting every time they need to go and visit or want to go and visit, but you may not be able to visit as frequently as you would like, because the facilities have to accommodate everyone. No one's rights are more important than the others. And so if you've got 35 family members who want to come in and visit and you've only got 15 spaces for them to come in, then the aged care facility will have to limit your visits. And you can't have one person having an hour's visit and another person having 15 minutes. But the only exception to that is in some circumstances when someone comes in from visiting from a longer distance, the aged care providers have been asked to allow that person, because the visits are infrequent, allow that person to maybe have a longer period of time if they can only come once every month or something like that if they're travelling a long distance. But it's really down to communication, local conditions, and allowing the person to visit in a safe manner. And if you can't negotiate that with your aged care provider, please call the advocacy service. We can assist you to do that.
Thank you, Marg. Janet, a question that's come through quite a few times, even in our live chat right now. During this lockdown, do residents have the right to leave the facility and follow the rules that the public are to follow?
Well, again, this might be more one for Joe than for me, because I refer again to the public health order. I'm just reaching for my notes here. My reading of the public health order is that residents from facilities in Greater Sydney should avoid leaving the facility except for essential reasons, e.g. medical appointments. Now, I like the response that Marg's provided in terms of rights versus choices. Choices have been diminished. Choices have been constrained for all of us. We're living in a pandemic. If a resident has a burning desire to go outside the facility, then that's a conversation that the resident or family on the resident's behalf should have with the facility manager. But you must respect the public health order. There are no two ways about that. And the choices will turn on the need for movement outside the facility and the people with whom you are likely to be interacting when you travel outside the facility. All of those are risks that would need to be carefully managed by the service and indeed by the resident and anyone who was accompanying them in that sort of external visit. So start with the public health order and then have a conversation with the approved provider, the aged care provider.
Thank you very much, Janet. We're just going to finish off with a few of the extra questions that have come through as part of the live Q&A. Michael, I've got a couple for you to start with. Jason asked, will home care workers also face mandatory vaccination?
So at the moment, no. At the moment, the National Cabinet only looked at workers in residential aged care facilities.
Thank you. And Michael, this came through from Andrew. I was given AstraZeneca for the first dose, but don't want to wait another 2 months for my second dose. With many countries around the world now adopting it, advocating for mixed vaccinations, why can't I get Pfizer for the second dose to speed up the process?
Yeah, so we follow the expert medical advice from ATAGI, the Australian Technical Advisory Group on Immunisation. At the moment, the advice is that you have 2 doses of the same vaccine. There is some research going on around the world, but only very small numbers of people looking at people who've had a dose of one and then a dose of another. So we don't yet know if it's safe or effective to mix the vaccines. So we continue to recommend 2 doses of the same vaccine.
Thank you. Lisa, this came through from Rosalba. In regards to consent, what's being done for residents and families who speak languages other than English?
Well, we've got a number of resources. So again, on our website, we've got printed information, but also lots of videos on the COVID-19 vaccination and vaccine safety. We've got that in 63 languages on the website. So again, that's www.health.gov.au. The other thing that residents can access is the Australian government's translating and interpretation service. So that's a free service. Your facility can connect you, and that can include immediate phone interpreting, and that's available 24 hours a day, 7 days a week. You can pre-book a session for interpretation over the phone, and you can have on-site interpreters. So aged care providers can use that service to support discussions with residents and family members who have English as a second language, and that's a free service. So really encourage people to enjoy it, make the most of that service.
Great. Thank you so much for that, Craig. Last question for you. How are those residents who cannot advocate for themselves, i.e. living with dementia, cognitive impairment, being communicated with during a facility lockdown, and who is in touch with their families? Are there guidelines in place to ensure this is achieved?
Yeah, very quickly that the facility staff will be working with that person. They still have a right to an advocate as well. So if people are concerned, again, give Pat and the team a call. And where they can't verbalise, I think there'll be family members. This might be someone who does need that sort of connection with someone who knows them well. The staff will be looking after that. Any concerns, give us a call.
Thank you, Craig. We are unfortunately out of time, but we wanted to thank all of you for the questions you've submitted today, and also for all of our speakers today. But before we go, we will put the links to all the various resources we've mentioned during today's meeting in the Q&A box. Please remember, if you would like to speak to a New South Wales Advocates support person, then you can always call OPAN on 1800 700 600, and our team at Seniors Rights Service will be there to help you. Thank you again, everyone. We wish you and your families well.